Great day. This is Dr. Rob Navalta, your Kairos World Medical Director and the consultant of heart rate variability and Smart Pulse test. Basically, if it's your first time to have your Smart Pulse test, it is a test that analyzes your overall cardiovascular health, heart rate variability and mean heart rate, elasticity of artery and peripheral stiffness, aging of blood vessels and blood circulation. It also can analyze your mental and physical stress and resilience, and also the basic screenshot of your autonomic nervous system function. So it's like with periodic screening, you have a smart health coach. It's a biofeedback tool so that you can analyze and adjust your lifestyle, your exercise, your sleep, your including your diet, so that you will achieve with different metrics how you can adapt with different kinds of lifestyle for you to perform well in your everyday task. So the basic reading when it comes to smart post test, this is basically the test. So on the left side of your screen is more of the HRV or heart rate variability. It's the beat to beat interval of your heart rate. So it tells something about your adaptability and resilience to different stressors. You can see the physical stress that indicates the degree of the pressure to our body, which is suffering from fatigue or stress. Mental stress, if it's higher, it indicates the degree of the emotional stress, anxiety, worry, tension, lethargy, which is suffering mentally. Your overall stress score tells you the average of your physical and mental stress. And very important is your autonomic nerve balance, which is the degree of the tension and relaxation of your sympathetic nervous system and parasympathetic nervous system. For our purpose, we would like to look into the right side of your smart pulse result, which is more of the arterial health or what we call the APG or accelerated photoplethysmography. And we look at the wave types from level 1, 2, 3, 4, 5, and 7. So if you are detected after the smart pulse test of type 1, meaning to say your blood circulation and blood vessels are excellent, you just continue your lifestyle, you sleep well, you do your exercise, you just continue your lifestyle habits and changes, including your supplementation. For type 2, its blood circulation and its vessels are good. So more or less, I would recommend that you continue to execute your habits and lifestyle so that as long as you're feeling good, you don't have any symptoms like chest pain, difficulty of breathing, easy fatigability, headache, or different circulation problems, you are doing good when you're having a type 1 or type 2 result. But if you started having to have a result of type 3 and 4, meaning to say that you start to get agents in the blood vessels. The arteriosclerosis is what we call the bara sa mga ugat or your blockage of arteries. It also equates to your narrowing of arteries. So it's very important to do your lifestyle modification that includes your sleeping habits. It's very recommended that you sleep around 7 to 8 hours a day. You exercise around 5 to 15 minutes per day or at least 3 to 5 times a week. It's very important that you also adopt an anti-inflammatory diet, which includes fruits, vegetables, some white meat, less sugar, and less oil. I also recommend that you do meditation and do some exercises, relaxing exercises like Tai Chi or yoga. When you are detected or your smart pulse test is have a wave type of type 5, 6, and 7, these are blood circulation disorders. If you are experiencing chest pain or chest heaviness, difficulty sleeping, numbness, and headache, it's very important that you be more serious when it comes to your lifestyle modification, including your sleep, exercise, diet, meditation. And I also advise that you go to your friendly physician or doctor to have a complete panel of different tests, which includes the blood works, the ECG, probably a 2D echo, or yet a CT scan, especially if you're in the type 6 or 7 zone. So, lifestyle modification, your metrics, and coaching is very important when it comes to improving your wave type from type 6, 7, or 5. That your goal is at least you have type 1 and 2 reading in your smart pulse test. These wave types are manifestation of aging, but it's very important to adopt a healthier lifestyle so that you'll have your result that equates to performance, peace of mind, um, you feel better, and especially you do prevention. Very important also on the parameters is the arterial elasticity, which shows the degree of the blood flow and contraction power of artery from the heart to other parts of the body. It's more of the aorta or the big blood vessels. To improve the numbers, I highly recommend that your result is around 50 to 100. That's a good test. And if you have a lower result, like 25, 30, or yet 2 or 5, I highly recommend to adopt the lifestyle changes that I mentioned earlier, including your sleep of 7 to 8 hours a day, your exercise of 10 to 15 minutes a day, 3 to 5 times a week, your low salt, low fat, low sugar diet, and anti inflammatory diet, your meditation of around 5 to 10 minutes a day, maybe 2 to 3 times a day. And if you have a lower arterial elasticity of 2 to around 20 to 30, still I recommend that you consult your friendly or trusted attending physician or doctor. It's same with your peripheral elasticity. So it's more of the blood flow and blood vessels around your extremities. So you adapt a healthy lifestyle, low salt, low fat diet, and you ask your coach on different metrics and how to execute healthier lifestyle and healthier um, habits throughout the day. So our goal is to have a wave type 1 and type 2. But I highly encourage everyone that we go for the type 1 blood circulation, which is an excellent blood flow. And for me, a peace of mind for you and your family. The arterial score represents the overall health condition of your blood vessels throughout your body. The higher score, around 75 to 98 to 100, is our goal when it comes to the APG parameter or your accelerated photoplethysmograph. So it's all about lifestyle modification, antioxidant diet, which includes also our supplements like our trans-resveratrol, polyphenols, magnesium, theanine. You may take your fish oil, but please ask your trusted physician so that you can have a better recommendation and guidance. And also our Smart Pulse coaches, which are hands-on when it comes to our um, improvement and lifestyle modification when using the smart pulse test. So thank you very much for this short video and your attention. God bless your journey and your um, smart pulse test before and after the coaching process.